Greetings, everyone. Let's break the monotony and tackle English with enthusiasm.
Here's a quick rundown of what we will discuss in our episode, and to help us stay on track, let's break it down into 3 chapters.
So, Chapter 1 is medical consultation. Today, we will define what a medical consultation is and discuss some general symptoms. Chapter 2 is medical professionals and facilities. We will cover different types of doctors, hospitals, and some medical tools. For Chapter 3 is all about treatment options. So, we will discuss various ways of treating medical conditions.
So, without further ado, let's get into it.
A consultation refers to a meeting between a patient and a doctor, where the patient discusses their health concerns, the doctor explains and discusses the symptoms, diagnosis, and treatment options. Now, to have a consultation with a doctor, you should first book an appointment. So, first step is booking an appointment. So, when you arrive, you will usually meet the receptionist first. She will ask you some initial questions or conversation starters like, what can I do for you today? How can I help you? What brings you here today? Do you have an appointment? May I have your name and age, please? Some additional information. So depending on the clinic or hospital, the receptionist will ask for more details such as your diagnosis or your medical history, especially if it's not your first visit. So depending on the place and the health care provider. So like I said, the questions and procedures may vary depending on the healthcare provider or giver and the location. So checking in with the receptionist, obviously you will wait for your turn. When called, you will proceed to the doctor's office or what we call doctor's surgery. Now here what happens next. So first thing that will be done is sharing symptoms. You will discuss your symptoms with the doctor, describing different signs of physical or mental pain, or both. Second thing is diagnosis. So the doctor will analyze your symptoms to identify the underlying illness or condition behind those symptoms. Last thing is prescription. So based on the diagnosis that was provided by the doctor, then the doctor will prescribe an appropriate medication or treatment options. This process allows the doctor to understand your condition and provide a personalized care, plus he will make an accurate diagnosis.
Moving on with medical history and symptoms. Now, when you visit a doctor, they will typically ask questions about various health issues, starting from head to toe. I can tell you what you may expect. For general symptoms, you will find questions about, for example, your lifestyle, like your sleep, your appetite, if there's any weight changes lately, recent weight changes. So here's the questions. Do you have fever or chills? Are you suffering from fatigue or night sweats?
Ask questions about rashes like, are you currently suffering from rashes, dryness, or itchiness? Do you have hives, bumps, sores? You can generally ask about any recent changes in skin, hair, or nails.
Asking about vision issues, like have you noticed any recent changes in your vision, like blurriness, double vision, or blind spots? You could also ask the patient for their last eye exam.
For hearing symptoms, ask them if they wear or have hearing aids,
which is a small device that help people hear better. Another one is ringing in the ears, which is called tinnitus. In French, we say tinnitus. So the question is, are you bothered by some ringing in the ears? How often do you notice the noise?
Talking about nose diseases, you will find questions like, are you experiencing stuffiness, runny nose, in another form, rhinorrhea? Do you have bleeding, or which is called epistaxis? Another question is, are you suffering from sinus pain or changes in your sense of smell?
Questions about teeth or gum issues like, do you have bleeding gums or sore throat?
Or have you noticed voice changes? Ask about their frequency of visiting dentists, like when was your last visit and why? Symptoms like coughing, the question would be like, do you have cough? Another thing is sputum. You can ask about its color, consistency, and smell. Sputum is kind of mucus the body produces to protect the respiratory system. Another question is, have you had palpitations or difficulty breathing recently? You can also ask about their last chest x ray.
Questions about discomfort, tenderness, or changes in breast tissue.
You can ask about their last clinical exam or mammogram.
Which can cause abdominal pain, bowel habits, or digestive issues. Also, one of the symptoms is anorexia, which means not wanting to eat. Adding to that, a heartburn, vomiting blood.
For general questions, it will be about muscle pain or joint pain, and also questions about swelling. Let me give you an example for that. Do you have muscle pain or are you experiencing joint pain? Have you noticed any swelling? Eating disorders can cause symptoms like easy bleeding and bruising. Another symptom is blood clots. In French, we say
Des caillots sanguins.
questions about cold extremities when fingers change color because of cold temperature. There's also leg cramp, leg ulcers, varicose veins.
Varicose veins are enlarged, twisted veins that typically occurs in the legs.
Those are the symptoms that you can ask patients about. You can ask about dizziness, headaches, seizures, fainting, or numbness.
Burning sensations, trembling, pain when moving or walking, also the ability to walk, memory loss, difficulty concentrating, and behavioral changes, any kind of behavioral changes. Now let's move on to endocrine and psychiatric symptoms. For endocrine, there will be recent changes in heat or cold intolerance, excessive sweating, hair distribution or texture, and breast changes. For psychiatry, there will be questions related to emotional distress, nervousness or anxiety, mood or personality changes, sleep disturbances like insomnia, hallucinations, or delusions. These questions help doctors assess potential endocrine and psychiatric issues such as hormonal imbalances or mental health conditions. That was pretty much it for today's chapter. Hope that wasn't hard to digest and you could add some of these medical terms to your vocabulary. Also, if you want to follow along, check the description box below for a downloadable PDF. Thanks for tuning in. Keep practicing, keep learning, and see you next chapter. Bye bye for just now.